Around the country, some children who have had COVID-19 are developing strange symptoms in response to the virus, and it has parents worried. But is there cause for concern? Fox 55's Caleb Saylor is live in Fort Wayne to explain what doctors are saying about these symptoms. Caleb.
The Allen County Health Department held a discussion panel today to talk about a number of different COVID-related topics impacting children. One of those being what's called multisystem inflammatory syndrome in children, also known as MIS-C.
Multisystem inflammatory syndrome in children has only recently been discovered in children who have had COVID-19. It's similar to something called Kawasaki disease, another inflammatory disease that's been known about for dozens of years. But James Cameron with Lutheran Hospital says they are not the same.
And it found that children that had a past history of a COVID-19 diagnosis were showing up with findings that consisted of a persisting fever, low blood pressure, multi-organ involvement, and that included anything from the heart, the intestines, the kidneys, the blood, the skin, or the nervous system.
Pediatrician Tony Giaquinta with Parkview says not much is known about the syndrome, both because it's new and so few cases are being reported.
It is extremely rare. And so while we are still learning more about it, this is a disease that we've seen in less than 100 cases of children throughout the United States so far.
A majority of those cases were reported in New York State 2 weeks ago. Only one case of MIS-C has been documented here in Indiana. This disease only affects children, and as the number of children diagnosed with COVID-19 increases, the cases of MIS-C are expected to increase as well. Cameron says MIS-C is a reaction from getting COVID-19, not something kids can catch. So as children head back to school next year, this is not something you need to worry about your kid getting from one of their classmates.
It's an immune response in the body that is not associated with them being contagious necessarily. This is their body trying to figure out what happened inside their body. It's not something that they're going to give to somebody else.
Just to reiterate, MIS-C only happens in some COVID-positive kids, kids being defined by the CDC as those under the age of 21, and is a child's body's reaction to having had COVID-19. So they can't spread it to other kids. And if you want to prevent your kid from getting MIS-C, you need to try to prevent them from getting COVID-19. Reporting live in Fort Wayne, Caleb Saylor, Fox 55 News.
Both Giaquinta and Cameron say that if you need to take your child to the pediatrician for any reason, offices are ready to safely see patients.